For last 10 weeks, we talked science, insulin, mitochondria, and circadian rhythms. Today, I want to take you somewhere deeper into the exact 10 minutes that start every real transformation in my clinic. Because let's be honest, information is everywhere. ChatGPT can create a perfect meal plan. YouTube has thousands of workout videos, and Instagram is full of hacks and biohacks. So, why so many people still fail? There are two primary reasons. These people do not hate their current reality strong enough to make a move. Secondly, mental fatigue crushes them before change becomes a rhythm. So let me take you to my clinic and show you the initial conversation that changes everything. When someone sits down, looks me in the eye, and says, I have type 2 diabetes, I have fatty liver, no excuses, tell me the plan. This is not theory, this is raw truth of change. Let's have a look. I've seen hundreds of times. A patient says, my sugars are slightly high, but I feel fine. Only to return 6 months later with worse numbers, having numb feet, poor vision, and their doctor has doubled their medication. It's then they realize the pain of staying the same outweighs the comfort of staying stuck. This is when a real transformation begins. You need that enough is enough moment in your life to start the change. Now look at that decision fatigue. We live in a real world. We have jobs, spouses, kids, parents, debts, mortgages, late nights, and endless scrolling. By 8 p.m., if pizza and Netflix are staring in your face, no perfect diet plan can save you. That's why it's not about what to do. It's about creating a rhythm where the right decision is already made for you, where health happens by default, not by willpower. Imagine we are in my clinic right now, one chair for you and one chair for me. On paper, biology is simple. We need to create a rhythm to manage your diet, movement, hydration, sleep, and stress, with an ultimate goal to flatline your insulin levels. Flatline insulin is the golden rule that keeps fat burning on and reverses metabolic health disorders like type 2 diabetes and fatty liver. But in reality, you have to drop your kids to school, look after your elderly parents, pay off that mortgage, boss keeps you late at night, Netflix at midnight, and multiple coffees to manage that afternoon crashes. On one hand, there is science. On another hand, you have your life. And gap between the science and your life is where your work really begins. Not with calories, not with carbs, with honesty. I want you to think for a moment. Who should be in charge in the consultation in this very moment? It's not my journey, it's yours. You are the hero of this journey and you need to go somewhere. My job in the consultation is usually to stay quiet and give the space. And what I hear is patients' inner dialogue, the conversation that changes their reality. And this is a conversation from my clinic. Doctor, I do not drink enough water. Maybe if I can keep the bottle at the kitchen table, I can start my day right. I can hydrate right in the morning. Maybe if I woke up 30 minutes earlier, I can exercise before I can drop my kids to school. That means I'll have to be in bed by 10 p.m. Oh, I'll have to shift my dinner to 7 p.m. and I'll have to start cooking at 6 p.m. Or maybe I can eat dinner with my kids. That'll be good for all of us. Oh, I'll have to speak to my wife. Maybe she wants to join me too. She wants to lose weight. Do you feel that? This is not me prescribing a plan. That's someone changing their reality right there in that chair. Removing decision fatigue, one choice at a time. This is when transformation begins. Not with hacks, not with supplements, with clarity and commitment. And the biology is clear too. If your reality is fighting you, your cortisol will spike, your insulin will spike, and your metabolism stays stuck. When your reality shifts into rhythm, biology falls into place. Once the clarity comes in, we build the 90-day plan. Remember, it's your journey and you decide the goal. Whether it's full remission or do you want to just reduce the medication, it's your choice. Because the aggression has to match the ambition. We start looking at some of the numbers: HbA1c, triglyceride levels, fasting insulin, kidney, liver function tests. And we assess where do you want to go in next 90 days. Remember, the aim is to flatline your insulin levels during those 90 days so you reverse the type 2 diabetes, you improve your numbers, and you reduce your medication. Of course, we look at the foundational factors: your diet, the movement, your sleep, the stress, and the hydration levels. You don't have to do all of this in one day. Remember, it's the start. Treat it like you are laying the tracks, one piece at a time. Because this piece fits into your reality, your life, the decision fatigue fades over a period of time and the metabolic rhythm sets in. This is where your real life meets the science and the success explodes. A word of caution: if you're following this series and making changes, make sure that you tell your doctor, because as your metabolic health improves, so does your medication needs changes. Your blood pressure will improve. Additionally, your sugar levels will come down and you may not need that much medication. You can suffer from low blood pressure and low blood sugar levels. Please, this is a serious advice. I would strongly suggest discuss with your doctor if you are trying to improve the metabolic health and you are on any medication. When I talk about metabolic health, I look at the foundation elements of metabolic health. All five: diet, movement, hydration, sleep, and stress. But it has to meet your real life. You are the hero of this journey. You have to change your journey if you want to improve your metabolic health. You may be sitting at home thinking, my metabolic health is poor, my numbers looks awful, but you can change it. In as little as 90 days, I've seen hundreds of patients improving their metabolic health in just 90 days. Type 2 diabetes reversed, fatty liver completely gone. So, don't make it one day, make it day one. You can change it over the course of next 90 days. Next week, we'll look at metabolic health numbers you need to know, what they mean to you and what perfect numbers look like, because that can help you decide your goal, what you want to achieve in those 90 days. Remember, knowledge is power when you live with it. And you can start your transformation today, because in next 90 days, you can change everything. I'll see you next week.